My name is Brogan Crokett. I'm a fourth year medical student at Rocky Vista University, Utah campus. Prior to coming to medical school, I was a paramedic for 10 years, serving all over the Rocky Mountains of the United States, where I got to interact with a lot of rural communities and a lot of rural patients, seeing a lot of the need there, and then pursuing a master's degree in healthcare administration and a secondary master's degree in biomedical sciences before going to medical school. During my first year of medical school, about 2.5 years ago, I went on a medical trip to Panama. I speak a little bit of Spanish and was able to communicate with a lot of the patients there. But I worked with an interpreter. That camp was only for 1 week. We traveled to areas that were kind of more on the suburbs of the capital city of Panama City. And that kind of left me wanting more. And so as I progressed through my medical education, I sought out more opportunities to come and work internationally, learn more about other cultures, learn more about healthcare in other cultures, so that I could be the best prepared physician in my future career to serve a wide patient population. So not only did I come to Kenya for the wonderful people, the fantastic food, but also Kenya's pretty gorgeous, wonderful wildlife. But I also got to see a wide variety of healthcare complaints that I don't really get to see in the United States. And these are people that truly need our help and have chronic ailments that need our help, not only from being an American-trained medical student, but just that they're not receiving a lot of care in general because they live in rural communities, and it's a long journey for them to get to the hospitals. And so partnering with the organizations, the local organizations, the government organizations, has really, I think, provided a foundation and a framework for what I'm going to do in my future career. Maybe come back to work here in Kenya, maybe work in other African countries, maybe work in other continents. But it's not that I do it for myself, but I feel like it gives me a good opportunity to work with the people. So while here in Kenya, some of the challenges that I'm facing and helping to maybe mitigate, not completely resolve, is healthcare literacy and healthcare education in these communities. One of the key aspects of Entepesi Kenya is to provide education and how to live the healthiest lives possible. But I find myself, while seeing patients, providing a lot of education in preventative health, in screenings, in managing chronic conditions that they've had for a long time, as well as addressing maybe the more acute and urgent needs of the community, but setting them up in a regard so that they can be self-sustaining, working with Entepesi, the local health ministry, to maintain overall community health for a long time.